Hello, I'm your host, Dr. Braha. Welcome to the Zermed Show. On the show, we will feature local community physicians who are experts in their respective fields and who will share their experiences and wisdom with us. We cover a broad range of health topics on the show, and we welcome today Dr. Cyrus McCalla, Chairman and Director of Maternal Fetal Medicine in the Department of Obstetrics and Gynecology at Brookdale Hospital Medical Center in Brooklyn, New York. Welcome to the show, Dr. McCalla. It's really an honor to have you here. Before we enter the world of obstetrics and gynecology and maternal fetal medicine, why don't you tell our viewers a little bit about yourself and how you ended up as a physician here in Brooklyn?
Excellent. Thank you so much. It's a pleasure being here this evening. Currently chairman of OBGYN at One Brooklyn Health, Brookdale Hospital. I've been there as chairman for the past 6 years. Prior to being chairman at Brookdale, One Brooklyn Health, I did my fellowship in maternal fetal medicine at Duke University Medical Center. Prior to that, I did my training in obstetrics and gynecology at SUNY Downstate Medical Center and Kings County Hospital Center. So I've been in Brooklyn for many years now, and it's great serving the community and taking care of the patients in Brooklyn.
Yeah, certainly. Brooklyn is a great place. It's a tremendous borough, a tremendous county. And a very large city if it was on its own in our country. And certainly we have our wide-ranging obstacles to healthcare and to maternal fetal medicine and obstetrics and gynecology. For our viewers today, can you explain a little bit about what the field of obstetrics and gynecology is?
Okay, so the field of obstetrics and gynecology is pretty broad. It starts even before birth. Women who are undergoing prenatal care, that's care before delivering their baby. It also continues during the labor process. We do see women for GYN care, or if they have problems during menses or fibroids. And this goes all the way up to the postmenopausal women who have stopped seeing their periods and may have complications, hot flashes, etc. So OBGYN is quite broad a field. We see patients for contraception, also for pregnancy termination, for unwanted pregnancy, so the whole gamut. It's a very broad field and a very exciting field to be in.
Yeah, it's a broad field and an integral part of a woman's health care.
Absolutely.
And what are some of the challenges that you notice here in Brooklyn to the women who need to get their obstetrics and their gynecologic care? What are some of the reasons they're not making it in to see you or your colleagues for their routine care, preventative care, and as well as their pregnancy care?
So the problem that women are facing, especially here in Brooklyn, in central Brooklyn, is very broad. There are a number of factors. Lack of insurance, for example, a lack of child care. Women who are homeless, for example, food insecurity. There are women who has medical problem, many medical problems that needs to be addressed, and that takes away from them being able to find time to come in and see the doctor. So it's a wide range of issues that can affect women seeing their physician, and ultimately that can affect their health.
Right, that's a great point to sort of transition to, is what are the risks of not getting your OB or your gynecologic care as scheduled or as needed for patients? What are some of the risks they're facing by not coming in to see you or your colleagues?
Right. So again, the risks are great. For example, for prenatal care, it's so very important that women come in for their prenatal care so that if there are underlying medical conditions that are complicating the pregnancy, they can be diagnosed earlier, treated earlier, and the impact on the pregnancy will definitely be less. It's also very important because during pregnancy, for example, complications can arise at any point during the pregnancy. There are complications of pregnancy such as preeclampsia, where your blood pressure gets very high, protein is being spilled in the urine, and some patients may seize. May have placental abruption, which is separation of the placenta before birth, rupture of membranes that can lead to serious infection. Infections in generally can be diagnosed before it becomes a problem during the labor and delivery process or delivery of the baby. Not only pregnancy, but getting routine care, screening for cervical cancer, doing pap smears, doing mammograms, screening for breast cancer, for example. So it's so very important that women come in for routine care, and especially routine prenatal care.
Right, and you're with One Brooklyn Health, which is a major healthcare provider in our county, in our borough in Brooklyn. What are some of the ways that One Brooklyn Health, and under your leadership in obstetrics and gynecology, what are some of the ways that you're knocking down those barriers or reaching out to patients who may not even know they need to see you?
Right. So we have made an effort to increase our presence in the community. We have family care centers throughout central Brooklyn, where women can come and see providers without having to get on a bus or a train. They can simply walk to one of the health centers. There we have not only OBGYNs, we have midwives, there are pediatricians in these centers, all the physicians, various specialty that can take care of a woman's health. So we make it readily available for for women, including pregnant women, to come in for care.
Right. And what about, you hear sometimes from patients, well, I feel fine. I don't need a doctor yet, or I don't need to see somebody, or women have given birth without doctors for thousands of years before medicine. What are some of the reasons, that we talked about, they can't access the care, insurance? What do you find is probably the most common reason? And what do you say to those patients who say, well, I feel fine, I don't need you?
Okay, so most women will do fine. There are, though, those occasions where you need help, and you may not realize that you're in trouble until the very end. For example, a situation like preeclampsia. Your pregnancy could be going along very fine, then all of a sudden, overnight, your blood pressure may shoot up to 170 over 110, or you may suddenly start to have bleeding without knowing that there is some complication of the pregnancy, like abnormal placentation, where you have the placenta covering the cervical os, what we call placenta previa.
And these are things that a patient will not know in general till it's too late.
Absolutely. Without care, without having the necessary ultrasound testing, you will not know. Testing for diabetes during pregnancy, you will not know that you have diabetes unless you're tested for it. Or at the very last minute, you may find that the baby's too big, or the baby's having difficulty because of diabetes or hypertension. So it's crucial for individuals to come in to seek prenatal care.
Right. Attack something early, get onto the disease early to prevent the complications later. It makes total sense.
Absolutely.
What about cervical cancer? We talk a lot about cervical cancer, the vaccine and prevention. For our viewers today who also, maybe a young lady watching who feels totally fine, what are the reasons to see that, an obstetrician, a gynecologist at, say, 18 or 20 or 25 years old, where they feel they have no medical problems in relation to cervical cancer and its prevention?
Absolutely. So you touched on a very important point, getting vaccines. Cervical cancer, for example, is caused by a virus. We do have vaccine that will protect not just women, but also young men against penile cancer, as well as women cervical cancer. So by getting the vaccine, this will decrease the risk of cervical cancer by somewhere in the range of about 80%. So for young individual, both male and female, this is available in New York State up until the age of 26 without any cost to the individual. And this can be a life-changing vaccine for these individuals. So again, not only screening, but also vaccination, and also not to mention contraceptive, birth control. It's available. And they're in our facilities, sometimes we may be able to offer it free of cost. So it's very important that young people as well get seen in our centers.
Yeah, there's very little in medicine that we can do that reduces the rate of a cancer as much as what you're describing here with the cervical cancer and the vaccine for HPV, the virus.
Absolutely.
That causes. And patients frequently ask me, how come I got cancer, for whatever cancer it might be, whether it's rectal or colon or liver. With cervical cancer, we pretty much know why the majority of cervical cancers occur, and it's because of this virus,
right,
which can be prevented with a vaccine. We can reduce that rate tremendously.
Absolutely. That's absolutely
It seems
correct.
to be one of the major accomplishments in gynecology in the last generation or so.
It is a tremendous achievement. And cervical cancer, in the past, we used to see many women coming in with late-stage cervical cancer, which impact their life tremendously, causing a significant number of deaths. And that has decreased tremendously since the advent of the HPV vaccine.
Which this vaccine could almost eliminate nearly all of cervical cancers.
Pretty close. It will not eliminate all of it, but pretty close. We do have a number of women who are immigrants into this country who has not had the privilege of getting vaccine or cervical cancer screening, especially coming from the Caribbean, from Africa, and Central America. So we still have cervical cancer in our midst, and we're trying to do our part to get the word out that this vaccine is available, screening is available, and protecting your health for the future.
Yes, so important. I'm glad we talked about some of these preventive measures and the reasons why our viewers should come see someone like you, an obstetrician, a gynecologist, or one of your colleagues at One Brooklyn Health, when they're feeling well, to keep themselves healthy.
Absolutely.
But you're also specialized in another field of OB, which is very interesting, and where you're working with high-risk patients. Describe to our viewers today what your subspecialty in OBGYN is, maternal fetal medicine, what we call MFM. Right. Can you educate us on what that means and why it's so important to pregnant moms?
Right. So to be an MFM, maternal fetal medicine specialist, you have to have completed an OBGYN residency, 4 years of an OBGYN residency, and 3 years as a maternal fetal medicine fellow, so 3 additional years of training. And at the end of your training, you are fully trained to take care of medical conditions in the mom, and as well as fetal condition. This will include not only women with diabetes, high blood pressure, kidney transplant, heart disease, lupus, all types of medical condition that can adversely affect the pregnancy, as well as if there is a fetus that's not developing well or have genetic abnormalities, and we're also equipped to take care of that pregnancy as well. So it's the comprehensive care of both mom and baby, no matter what the medical condition is.
Right. These conditions are higher risk for mom, higher risk for baby.
Absolutely.
And so the MFM specialist, like you, will take patients that seem to be at a higher risk of complications, what we call, morbidity, or even death, what we call mortality. Before the show, we were chatting a little bit about, in Brooklyn, we have a crisis related to moms not doing well during pregnancy or babies not doing well. Mm-hmm. Tell us a little bit about the crisis in Brooklyn or around our country and around the globe related to black moms who have a higher risk of morbidity and or mortality, death, or becoming quite ill with pregnancy, and how your role as an MFM plays with that.
Okay, and that's a real significant crisis. Black women are 3 times as likely as a white woman to die in childbirth. And the leading causes of maternal mortality, maternal death, includes cardiovascular disease, bleeding during pregnancy, or complications of hemorrhage, clot formation, whether in the deep veins or migrating to the lungs. Infection is also a significant cause of maternal mortality. What's also very worrying is that women, as they get older, are at a significantly higher risk for maternal death. If you compare a woman over the age of 40 to someone who is less than 25 years of age, they're more than 8 times likely to die in childbirth or complications of pregnancy than that young patient. So it's tremendous, the increased rate of black mom dying compared to whites, plus also the age difference in terms of maternal mortality. And with each maternal mortality, severe morbidity is again, for each mom that dies, there are about 10 moms who came close to dying. So it's a significant problem in our population.
And this is both here in Brooklyn and I'm assuming worldwide.
Worldwide. We here in the United States are still seeing a lot of mom dying. It's one of the highest rate among the developed world. And there are a number of factors that are contributing to this difference in maternal death rate. Part of it is also not only lack of insurance or lack of access to care, but really racism in the way we practice medicine. Black moms often are not listened to. Oftentimes they're not considered at risk, or their complaints are not taken seriously until it's too late. And there are a number of high-profile cases where black moms came very close to dying. So it's a real problem in our country, as a real significant problem here in New York as well.
How are you approaching this? How is your staff at One Brooklyn Health approaching this? How are you making a difference now, and
Sure.
What's the plan for the future to help these moms who are at significantly higher risk?
Right. So we have embarked on a number of cutting-edge programs to assist moms who are pregnant, one of which is centering pregnancy, and that's a group model prenatal care. Usually these are 6 to 8 moms in the group. They're scheduled to have their baby around the same time, so they buddy
like a support group?
Support group. They get educated. They're seeing a midwife during the process. Also, access to doula during the process. And why this program is important? It has shown to decrease the rate of preterm labor, preterm delivery, and also cesarean section rate. Cesarean section is also a cause of maternal mortality and morbidity. Women who have cesarean section are twice as likely to die as women who delivered naturally. So centering is one of those programs. We have also initiated a program where women who are at high risk, we have a midwife go out to visit them within a week of delivery. And this is crucial because close to 50% or more of mom dying in childbirth or around the time of childbirth happens after delivery of the baby. So once you deliver the baby and you leave the hospital, you're still at risk. Mom is still at risk for maternal death. So we recognize that, and we're making that effort to make sure that these moms, especially ones who are super high risk, are seen early, postnatally, for checkup to make sure that they're doing well.
So that, it's exciting to hear of the initiatives that you're taking to do it, to reduce the mortality and reduce the morbidity. But it's very interesting to know that after delivery, mom is still at risk, and I'm sure that's a shock to many people to know that there's such a high rate of complications occur after they've already maybe gone home or have had the baby.
Yes, absolutely. Women can develop clots after delivery. They can also develop hypertensive crises related to pregnancy. One of the high risk factors that I didn't mention was also substance use. Substance use as well as psychiatric disorder are leading causes of maternal mortality in this area. As a matter of fact, One Brooklyn Health, Brookdale Hospital is participating with the New York City Health Department. It's called the substance abuse, substance use disorder, as well as perinatal mood disorder. So we're trying to find ways that we can close that gap so the patients get psychiatric care, also care for their substance use during pregnancy and the postpartum period. So we're looking at this from all different angles in terms of how we can provide help to our population and to make sure that our moms are continue to be safe and well.
Right. So it sounds to me like the answers are there to a lot of these problems. It's just connecting our patients to the right resources. And
absolutely,
it's exciting to hear that One Brooklyn Health and you and your team are doing this. We want moms to be healthy. We want healthy babies, and it sounds like an ounce of prevention is worth a pound of cure. And if you get in early to see someone like Dr. McCalla or his colleagues, probably a better chance at having good outcomes with pregnancy.
That is true. As a matter of fact, roughly about 80% of maternal deaths are preventable.
Tremendous number.
It's a tremendous number. So getting in early to seek care and getting the right provider go a long way in terms of better health and better outcome for mom and baby.
I've certainly learned a lot, in our time together today. But as we near the end of the show, I'm sure everyone's wondering, and our viewers are wondering. I'm wondering, MFM, your subspecialty that you're in, which is really high-risk pregnancies, it sounds to be very stressful. Sounds to be a real challenge. What brought you in? Is there something in your life that brought you to this career path?
I grew up in the Caribbean. I was born in Jamaica, went to high school in Jamaica before coming here to the United States. And one of the most distressing incident for me was a young mom who I knew very well, died in childbirth, actually. And I always remember that individual. And, you know, what happened? I don't know exactly what happened to her, but, you know, going through college and medical school and the residency, it becomes clear that, you know, I think I can make a difference. I can make a difference in, you know, family lives, the lives of women who are pregnant and women with complication. You know, I look forward to the challenge, and you know, I would not work anywhere else but Central Brooklyn. We have tremendous number of sick patients, high rates of morbidity and mortality, as we spoke about, and the help is needed in those communities.
Sounds like your help is there, and you're up for the challenge, and I'm sure you're going to make a huge difference in many lives with you and your team members at One Brooklyn Health, and with the obstetrics, gynecology, and the MFM team that you have. I wish you good luck, and our residents in Brooklyn are lucky to have you and your colleagues. So thank you for joining us.
Thank you so much. Thank you for having me. This was quite a delightful conversation.
Absolutely. I learned a lot, and I'm sure that you at home, our viewers, learned quite a bit here from Dr. McCalla, obstetric, gynecologic specialist at One Brooklyn Health, the chairman there, and a maternal fetal medicine specialist who takes care of the highest risk pregnancies, the highest risk moms, the highest risk babies. And so I'd like to thank you for watching today. Thank you for your interest and your desire to become more involved and educated. I invite you to visit our website, www.zirmed.com. Check out our tools, connect with us on social media. Stay healthy, Brooklyn. Thank you for watching us. Stay safe and be well.